Well, at one time or another, most people have endured a nosebleed. Your kids likely more than you. It's pretty common, but like all things, some are more complicated than others. So here to share some great advice on treating and preventing nosebleeds, our friend Dr. Evan Tobin with Ohio ENT and Allergy Physician. So Dr. Tobin, thanks for being with us.
Thanks, Robin. Thanks for having me.
All right, I'm sure there's no one cause of nosebleeds. There's probably a number of reasons. What are some of the more common reasons that people get nosebleeds?
Well, first of all, it's a really common problem that we see in an ENT practice, and a primary care doctor will see that too. And they fall into kind of two categories. We see these more annoying nuisance bleeds commonly in kids, and as many as 30% of kids under 5 will have nosebleeds, and up to 60% of kids by the time they reach age 10 will have nosebleeds. And it's usually from some dryness and irritation in the front part of the nose called the anterior nasal cavity. After a cold, it gets a little bit irritated. In the wintertime when it's dry and we have our furnaces on, they get a little sore, and so one of the minor blood vessels opens up, and then it bleeds. And usually they're self-limited and easy to stop, but they can become recurrent and frustrating and even scary. And so that's the kids. In the adults will also get these anterior nosebleeds, same thing during the winter months when it's dry or after a cold. But adults who may have other medical problems such as high blood pressure or be on blood thinners, they're more at risk for posterior nosebleeds, which is bleeding from the back part of the nasal cavity where there are some larger blood vessels. And those can be more troublesome bleeds and can be more serious bleeds and require more complicated interventions.
So is it, you need to know when there is cause for concern, right? So is it the number of nosebleeds? As a person out there, if you get them, how do you know when there might be an issue?
Right, yeah, so the recurrence is an issue. An occasional nosebleed in a child that stops easily with a little bit of pressure, not much to worry about. As they become more recurrent, or if they become more severe, or certainly in a patient who has other medical problems and might have blood pressure and it's not clear whether that's controlled or on a blood thinner, then those ought to be evaluated, because there are conservative things that we can do to help and prevent the nosebleeds. There are simple things that we can teach patients to do to stop their own nosebleeds. And then there are reasons that we want to investigate further and things that we can do to help the patient get fewer nosebleeds.
And on that, let's look at some of the things you brought, because these are probably things people can keep in their cupboards, right, in their cabinets, and have on hand if they suffer from nosebleeds. So what do you recommend people use?
So let's just take a child or an adult who's otherwise healthy, who's getting recurrent nosebleeds, and they don't seem to be particularly severe. The first thing that we recommend patients do is try to keep their nose moist with some saline nasal spray, and I brought this here. Ocean nasal spray is a good one. There are some nasal gels. We really like bacitracin antibiotic ointment to moisturize the nose. And then the key is to leave it alone, to let it heal. There's a temptation, you feel something that's irritated, you want to clean it with a tissue, and kids sometimes can't resist that temptation to clean their nose. So we want to let that heal up. A vaporizer in the room will help. After that, if the patient continues to have bleeding, there's a trick that they can do to stop a nosebleed acutely, and that's to take a cotton ball and get some decongestant nose spray, soak about 1/2 of a piece of a cotton ball, tuck that in the nose, hold a little bit of pressure for 5 minutes, and that's going to stop most anterior nosebleeds very, very quickly. If it's getting past that, those are patients that we probably ought to take a look at to investigate a little bit more.
Okay, and there was something that you were saying, treatments we should avoid, and I think this is interesting because you mentioned you want to keep it moist, right, and things like that, and people may go to their cupboard and find Neosporin, Aquaphor, but those aren't always the best.
Well, Neosporin is an ointment that's great for a cut, but some people, up to 10% of people, are sensitive to one of the ingredients in Neosporin, and so most ENTs will steer patients away from Neosporin. I happen to like Aquaphor. Okay. I'm a bigger fan of an antibiotic ointment like bacitracin, because sometimes there is a little bit of a bacterial process going on there, and so not only do you moisturize with the ointment, but you can provide some antisepsis with it as well. Can
nosebleeds be prevented entirely?
It's tough. I mean, if you're at risk for nosebleeds, let's just say you've got a blood pressure problem or you're on a blood thinner, it may be tough to completely eliminate them, but the key thing, and I guess an important point I want to make, is in those nosebleeds that continue to be a problem, and especially if they're heavier nosebleeds or associated with lightheadedness, those are patients that either need to be evaluated by their primary care doctor or an ENT, and sometimes even be evaluated more urgently. So patient who maybe has some trauma to their nose or develops a nosebleed that it's not stopping, or the blood is not just coming out the front part of the nose, but is going down the back and they're spitting up some of the blood. These are things that ought to be seen in an emergency room, because then the intervention is a little bit more complicated.
Okay, and they can certainly start with Ohio ENT and Allergy physicians. The number is up on screen for you. Thank you so much for being here.
Thanks for having me.